While we're all focused on COVID-19 as we prepare for a new school year, a New York mom is on a mission to make sure parents are aware of another life-saving vaccine that could have saved her daughter's life. Stephanie Stone has her story.
She just loved to entertain and make people laugh, and she really just enjoyed life.
It's still painful for Patty Wukovitz to talk about her only daughter. Kimberly Coffey was a high school senior who was in her last 2 weeks of school. She'd been accepted to nursing school and was ready to launch her career. She wanted to follow in her mom's footsteps and be a nurse. One day, she came home from school with a fever.
By the next morning, she wasn't fine at all. We woke up the next morning and she said, "Mommy, everything hurts me. From my eyelashes down to my toes. This is like really, really bad." She couldn't even sit up. She couldn't pull her head up off the pillow. It was just, she was completely lethargic.
Kimberly told her mom it felt like her ankles were bleeding. Patty saw purple dots and rushed her to the emergency room.
One of the doctors pulled me aside and she said that we believe your daughter has bacterial meningitis. And I told the doctor that's not possible because I made sure Kim was vaccinated with the meningitis vaccine.
She learned that Kim wasn't fully protected.
At the time in 2012, when Kimberly got sick, we did not have a meningitis B vaccine in the United States. So I couldn't protect her with that. She didn't have the privilege of having a meningitis B vaccine.
Dr. Paul Offit, professor of pediatrics at Children's Hospital of Philadelphia, says it's a vaccine that's necessary and reduces your chances of the type of pain, loss, and suffering that Patty lives with every day.
There's 5 different strains of meningococcus that cause disease. One type of vaccine, and there are a few of these, is to prevent 4 of them, so-called the four of the strains A, C, W, Y. Then there's the other one, the B category. So there's 5.
I am promoting awareness of her story so that this does not happen to anyone else. It does not have to happen any longer. We have a meningitis B vaccine, and it should not be happening. We shouldn't lose one more child. But again, if parents don't know about it, they might not know to ask about it.
Even in the COVID-19 era, Patty is doing webinars, educating everyone about the 2 separate vaccines and empowering parents and families to have the conversation before they head back to school this fall. I'm Stephanie Stone, reporting.